About 50% of the cases that we see for an active release technique specific treatment has to do with peripheral nerve entrapment syndromes. So just as the soft tissues can create adhesions in the tissue and lay down scar tissue, so can the nerves. So the nerve can actually get sticky and stick to the adhering muscles that they course under, over, or through. So there's sites on every single body that will have entrapment syndromes. So the entrapment syndrome that we're going to work on right now is the radial nerve. So the radial nerve courses right through here, and the one that we're going to work on today is the pronator teres as it comes in contact with the brachioradialis. This nerve courses through the two of those. So the pronator teres, obviously pronator of the wrist and forearm here, brachioradialis bends with the wrist in neutral at the elbow in deflection. What we're going to do is we're going to palpate for that nerve. Obviously you can palpate right over it here without the skin or the fascial layers, but in a real life patient you take a lot of time finding exactly where that nerve is. Palpating nerves is a long-term skill, so a lot of practice using it on a lot of bodies is really key to get your skill set up. But what it's going to feel like is a little piece of linguine out of the muscle. And as you go to tension it and go for active, it's actually not going to tension at all, so you can differentiate that between contractile tissue and nervous system tissue. So what we're going to do on this is I'm going to tension right between this insertion point between the brachioradialis and the pronator teres, right where these two come in contact. And I'm not going to get right over the nerve, but I'm going to come to the side of the nerve here. So we're going to shorten up all these muscles just as we did the last couple at the elbow. So we're going to bring the elbow up into flexion, and we're also going to pronate that wrist to shorten up the pronator teres muscle. I'm going to tension down right at that joint space. I'm going to come down in, extend the elbow, supinate the wrist all the way through, and you can see that nerve tension right up. It jumped right out over. So the nerve is now right here. I'm holding the pronator teres this way, and the brachioradialis is also tensioning up, so separating the nerve between these two structures. And as I tension up, you can see the tension build through that radial nerve. So this protocol will actually get a little bit of reproduction of symptoms, especially if this radial nerve is involved with an entrapment syndrome. So patients will have about a minute of a little bit of a paresthesia and tingling sensation, especially within the dermatomal and myotomal patterns of the first three fingers here. So letting them know that that could possibly happen is really important, just so you can keep up the patient rapport and the trust factor. So I'm going to run that one more time here. Watch that nerve tension right up. So I'm bringing the musculature proximally. That nerve is being tensioned distally, and we're sliding and gliding that nerve between. And in more advanced cases, you can actually pulsate through the first three fingers into extension and flexion just to make sure that nerve is getting loosened up from the surrounding tissues.